The University of Wisconsin-Oshkosh Fox Cities campus assists the City of Menasha with video recordings of city meetings. Menasha residents and interested parties can get information about city meetings, meeting agendas, and other documents from the city website, www.cityofmenasha-wi.gov. To express opinions about City of Menasha issues or these broadcasts, contact the Mayor's office, 920-967-3608. Contact the City Alderman. Contact information appears on the website. Or complete the electronic feedback form on the City website. All public portions of the meetings are recorded in entirety and are not edited.
Good evening. I'd like to call the City of Menasha Common Council to order. Please rise and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If we could have the roll, please.
Alderman Tom Grady.
Here.
Alderman Ted Grady.
Here.
Alderman Rapella.
Here.
Alderman Nichols.
Here.
Alderman Eisenach.
Here.
Alderman Sevenik.
Here.
Alderman Hammond.
Here.
All are present with the absence of Alderman Schmidt.
Thank you. The first item on the agenda this evening is the public comments. Is there anyone from the public who wishes to speak? Doesn't seem to. Oh.
Oh, here, take hands.
Yeah.
Oh. That'll work.
It looks like it's setting up yet.
Typically, it turns red.
Is that, oh, no, okay, now we're good. Hi, Sandra DeVille Taylor, 545 Street. Oh, now we got an echo.
Yeah.
They're both working.
Thank you.
You were.
Typically every year I try to go through the budget, review things. I'm very surprised when I pulled it up this year. There's like no detail. You get the summary, and some departments are listed, and you have a pie chart. And then if you want to actually print out a page, just the mayor's executive summary, you have to supply the city or a third party with their email address, which will then generate a PDF that they will email you in order to print it out. That's ridiculous. I wanted to print something before I left. I'm not going to wait around. And why should I have to, or for that matter, anyone have to supply the city with their email address just to print
It's off now. So with that, I'm not sure where she was looking because I can see all the same detail we could see in the old book. The only thing that's missing was the first page that basically she has in the newspaper, and that was in the front cover of your budget book. But otherwise, there should be a listing of every department with every classification number with last year's budget, this year's budget, and a percentage of increase or decrease on everything, as well as the projected 2022 spending. So apparently there needs to be a little bit of a tutorial on how to use it a little bit more, but all those numbers should be out there and should be available to the public. That is not us. That is the way ClearGov works. Once the budget is complete, we could put a PDF out there that we generated and have it work that way. But that if you go to any budget that ClearGov does, the software provider, that's how they do it. I'm not sure exactly why. I went around and looked at probably 10 or 15 different communities that used it, and that's how I had get most of them as well. A couple of them hosted a PDF on their website, but it's really designed that you should be able to click on the different things easily rather than going from the table of contents if you look at the web version of it. So with that, Chief Clone.
Thank you, Mayor, members of the council. We do have a small PowerPoint for tonight, just a brief synopsis of this past year. So I'll have Deputy Chief Krieger kind of scroll through some of that as we all set. So the first couple pages are just our mission statement, our core values, and our vision statement. You've probably seen that on some of the documents that we've created over this past year with our when we did our strategic plan. So same mission, vision, and core values of our department, something that we created a few years ago as a committee. And then looking at the next page, our table of organization on page 3, that has not changed as well. Same 5 admin staff, and then 3 shifts of 21 firefighters led by a shift commander from each shift that leads each shift. Did we get a new chief? I hope not. Yes, our fancy hats. On page 4, this was our response over the past year. So average on scene 5 minutes, and that includes turnout time. So that's the time it takes for when the alarm goes off for the crews to get dressed and hop on the truck and respond and then arrive on scene. So 5 minutes, pretty good, way above average of the norm, which I believe is in that eight minutes, I believe. So we're doing very well with that. So, and then broke down some of our calls for this past year. 72% are emergency medical calls. And then we broke it down with fire alarms, fire calls, and then other service calls, hazmat. So we've had about 51 fires this year. We've had 1,877 EMS calls and 15 special incidents, which are water ice related calls. So I do want to make a note in there, and I think we'll probably talk about it later too, but one of the things that we've noticed over the past year is, or through October, is that we have had 6 saves between the 2 cities, and I just got word that Sunday we had another save at one of the churches, and so that could be number 7. So that's somebody that physically was pulseless, not breathing, walked out of the hospital. So that is, I know 6 or 7 of some of the EMS calls that we go on, doesn't sound like a lot, but if you were to have go across here, 6 or 7 saves is amazing. It's a very high rate of somebody having that not breathing, no pulse, and being able to walk out of the hospital. It's an incredible, I don't think we've ever had that rate before. So I attribute that to the training from our staff. We do have paramedics, EMTs, and a mix of medical responders. And I attribute it to being able to be quick and leave from the station or training or wherever they're traveling to get to those calls in time. So I got a letter, and I put this in the program, a letter we just received from a resident that brought her husband back after he collapsed in the garage, wasn't breathing, and she wrote a very nice letter about him being able to see his grandkids and his kids, and it's pretty cool when you get to see that and have that person come to the fire station and thank the crews for being there. So. Page 5 is, again, showing that it's about a 2-minute drill, and we practice this, trying to get out of the station as quickly as possible, getting dressed, 2 minutes out the door. We have about, again, 2,600 incidents so far through October, so we are above average by about 200 calls a year right now. So last year we ended with like 2,971, and right now we're on pace to do about 3,200. So average last year was about 6.8 calls a day, and there's days where we're at 9, 10. Sometimes we've had 15 calls during the day. So pretty busy. Again, EMS calls are the high end of our call volume, but again, even though we do have Go Cross in our community, which they do a great job, the transport part of it, probably 95% or more were there first and are able to start performing whatever medical care is needed. So some of the fire containment areas that we've had 22 building fires, 10 structure fires that were contained to the object of origin, 6 fires contained to the structure, and then 265 fire alarms and 15 special incidents, again, the water or ice rescue type incidents. And then page 6, apparatus. And we all know that we have not had very good luck with our apparatus this past year, and it mostly due to the 2 oldest trucks that we have. And it shows in the pie chart that we have is that engine 31, which is ordered in January, was about 46% of our maintenance budget, and engine 32 was about 1/3 of the budget. So between those 2 pieces of apparatus, we and again, those are the 2 next vehicles to be replaced. They are on order. Engine 31, which was normally a 10-month build, is 18 months now. And the one that we just ordered a few days ago for 2024, that's a 3-year build. So we had to get it ordered. Plus, then there would have been a 7% increase if we hadn't ordered it by November 1st. So that market of, and I'm sure the larger vehicles too with Public Works, and that it's crazy to try and ambulances, the departments that have ambulances, they're almost a 2-year wait as well, so.
I have a technical question. When you
Yes.
say apparatus, what
I'm
does that
sorry.
mean?
So our engines, our fire engine
Okay.
or our ladder truck.
Okay, I assume that's what it meant, but I
Yes.
just wanted to be sure. Thank you.
Yes, you're welcome.
Just to clarify that, the 46% on engine 31, that means that when something is not functional, broken, needs repair, almost half of the repairs came from engine 31. So it wasn't 46% of the cost, it was 46% of the time in which we have to spend working on that truck. And then 32 was the most expensive for cost of repair.
So on page 7, we have grants. And we were very lucky this year. Was a good year for receiving grants. We received a grant for it's a Plymouth system, but what it is an exhaust removal system, which is already at Station 35. However, it was installed back, I think it was in 1997, and it was a free system because the company that installed it they were trying to get their name into the area. And so I don't know how many years ago, probably 10 years ago, they went out of business. And of course, now we're trying to find parts for that. Is the mechanics are making parts at the station to keep it running. So we were able to get a grant, and that will be replaced. So that a system is a system that is, when a truck comes into the station, they're able to hook it up to the exhaust system, and then it stays on the truck. As the truck leaves, it follows the truck out the door and then releases as it gets to the door so that all the exhaust doesn't get sucked back into the building. Of course, the police department on the other side as well, so the air exchanger filters it out and takes it out the side of the building. So we did receive that. That was about 62,000, 61,000, somewhere in there. So the next one that we received, and this was recent, we received a EMS Flex grant, and that was approximately 120,000. And that will be for some, used for EMS for training equipment. So it'll help relieve some of our CIP monies in the future with the replacement of our UTV and possibly some PPE and EMS training. So. And then we received about $2,000 from We Energies to replace our gas monitors. And so the gas monitors, again, the past 2 years, we've used them more than ever because of the digging going on in both cities with the upgrade of cable. So, but the gas monitors were very nice. Addition to be able to replace what we had. So those were the grants that we received this year so far. And then some of our achievements on the next page. We've completed through October approximately 12,000 hours of training. We have met about 17,000 residents, kids, adults in some of the CBRFs that we visit through both cities. We put together a new records management system, which was no small task because we've used the same system since 1996. And so we started, of course, small with that, and then as we got inspecting and we kind of added modules to it over the last 25, 30 years. And then that company also was getting bought out by other companies and it just kind of dissolved. So we had to find a new records management system. And of course, there's none out there that took care of all the aspects of what we do for Neenah Menasha. So we used, you know, the fire reports and the EMS reports. We did the inspections and the inventory. And so the scheduling was on there. And so none of the new programs that are out there now can do all of those. So we had to purchase 3 different programs to take care of scheduling and maintenance and fire calls. And so to install all those things, we started sometime in March or April. And probably for the last 2 months, all 3 have been up and running. And it's actually working very well with a couple of, you know, hiccups here and there that we've been able to work out with being able to call the company and work out some of the problems. So very happy with that and how it went, because I know trying to transition into a new records management is not always the easiest, but we did it, and very proud of the staff for getting it up and running and working. So a lot of things are being able to work through iPads, and we're trying to make the iPads work so we don't have to have the expense of mobile data computers on the truck that are $7,000 a piece. So we'd be able to use an iPad. So we're trying to make that happen. And then that is the last one here was that letter that I received from the resident, Stephen Street and Nina, about the save that we had. Her husband was doing some work in the garage and they found him laying in the garage. But so just wanted to share that with you. It's always nice as the fire chief to be able to see all the work and the equipment that we have to put it to use, because that's what it's for. That's what we're here for, and to see that is fantastic. Very proud of the work and training our crews have, and very thankful for the council's support, the mayor's support, and being able to have that equipment that it takes to do that. So can take time later on to read that. I won't have to go through that right now, but does anybody have any questions of our year so far here in 2022?
I got a call earlier today or yesterday from Alderman Rapella, and he was concerned about, well, why don't you ask the question? I just wanted to make sure you didn't forget. And I said it would be better if the chief explained.
Oh, I gotta push my button. So Chief, looking down at maintenance of motor vehicles.
Yep.
213. So it went from, in 2021, it was 31,575, and then you budgeted it up to 64,200. And then now, you requested 90,000, but then it must have got cut down to 85,000. Explain where that cost, or why is that cost so high, the maintenance of the vehicles?
I'll start and touch on it, then if Shane wants to chime in, he can. He does a lot of work with our mechanics. I think over the few years when our maintenance budget was at that 30,000, 40,000, we were over probably every year since I've been chief. We're very close to being over, and was able to cover it through other line items that weren't used. And so having this year, like I said, being a crazy year, we had a first time in my career, I've been here 30 years, that we had to replace a motor on a truck because the motor blew. That was 40,000 on its own, just that one, which was our budget basically. So like I said, the two trucks that we have in our fleet, the oldest trucks are, they're not going to be replaced. Hopefully one maybe at the end of next year, and the other one not till probably 25. And so we just want to make sure that we budget enough to be able to continue with the maintenance and any other issues that, you know, may come up. But I will turn that over to Deputy Chief Krieger if he has anything else to add to that.
I pretty much covered it. I mean, it was that engine repair or replacement was pretty significant, along with the DEF system, which is the fluids that are added to a diesel engine to cut down on emissions, which that was kind of a costly repair and unavoidable, really. You have to have it. So that, and then we did a corrosion repair on engine 32 in the beginning of the year, so it went down to Waiawega for, boy,
2 weeks,
probably,
3
yeah,
weeks.
all of that. A couple weeks to have some corrosion repaired on it and protected. And then just this week, so we started an annual application process on the trucks and kind of moving forward. So that's a $2,500 investment in the program, but hopefully long-term going to cut down on the costs. So we didn't ask as much as what we spent moving forward, because we realized that this year was kind of an anomaly, if you will, with some of the repairs, but definitely want to keep the fleet going and invest in it. And if you don't mind me adding, we're odd in the fact that we have mechanics within our shift. So all of those expenses, or not all of them, but a large amount of them, we're not paying the labor separately. You know, so we're using guys that are on shift versus having to outsource that, which that would dramatically increase that cost. So we have a great crew there that's working on the trucks on a daily basis, and it's pretty nice to have them available.
One example of that is we also had a gas tank on one of our apparatus had a hole rusted in it. So we literally, Shane and I drove to Appleton, picked up a gas tank in 20 minutes, brought it back to Station 35, and our mechanics had it in the truck ready to go by the end of the day. Now, if that was a different product, a different company, and Shane was in that business prior to coming here, it would have took months just to find a gas tank, let alone being able to put one and install it in with our staff. That truck would have been down for a month or more. So we'd be able to literally turn it around in about 6 hours and have the truck back on the road. And so our mechanics are fantastic on what they're able to do with our fleet.
Okay, well, so in other words, like for my vehicle, it's an oil change and a tire rotation. So it's a little bit more complicated on a fire truck?
Absolutely.
Oh, okay.
Pumps and brakes and ladders and all those different systems have to be annually tested on every single truck that we have.
Okay.
So,
another question for you. On that maintenance of the training tower, number 250, you went from like $38 to $1,650 all the way up to $6,650. So what are you doing to the training tower? You showed me the training tower a number of years ago, but
yeah.
So what's the deal with the maintenance of the training tower?
A couple things. One, there is some additional maintenance that has to be done on the tower. We're probably going to have an evaluation on it. You can only use it so many times, start so many fires, but you do replace some of the materials, some of the items that kind of stop it from spreading into the whole building. And then in addition to that, you may recall last year we got a grant to put up a burn building, so it's really a metal enclosure. So some of that cost moving forward is the cost to rebuild. So we're essentially building 3 rooms in the building, light it on fire, and it simulates a residence. So it'll be furnished with carpet, somebody's old couch, and drywall, et cetera. And then that gives the opportunity to go in and do an investigation and find out what the cause and origin is of the fire. So that's an important training tool. So that's an addition, and that does have some operational costs, replacing drywall, et cetera, moving forward.
Okay. All right, thank you. And then last one, number 111. The fringes kind of gone up from $1,325,000 to $1,439,000. So that's over like $100,000 increase from last year to this year. So what brought about the increase in the fringes?
Fringes, that number is figured out through finance and given to us through their formulas or however they calculate that. So that I'm not sure. That's a number that we're just given to put into the budget.
All righty. Thank you very much then.
You're welcome.
Oh, last one I got to, it's on the next page, the 8149. Household purchases.
Yep.
You went from $9,720 to $15,000. What kind of household purchases do you guys need at the fire station?
It's the dishwasher, refrigerator.
Oh. So over the last year or two, so household items can be anywhere from the refrigerator, stoves, washer, dryer, can be the beds, mattresses. So I think we looked at replacing, we try and put that on a schedule as well and be able to replace some of those items as they go along. And I noticed that probably like anything, a refrigerator that you had back in 1980 would last forever, and you buy a new refrigerator today, in about 6 years, it's out the door, done, shot. So we try to manage and put that so we're not buying 10 refrigerators at one time or 3 stoves at one time. We try and manage, and as they're going bad, we try and purchase those in a at least an even keel type purchase.
And I had the pleasure to drive over to a local store to make a purchase of a refrigerator when one was out at 35 and the price has doubled. So if you've gone shopping, it's hard to find them, and when you do get them, the prices are crazy. So trying to reflect what it's really costing to operate.
Okay, thank you very much.
I wanted Randy to ask his questions first. So can you briefly explain the specs that we're doing with the fire trucks, especially with the discussion of corrosion, because that's been an issue that we've had with our trucks? And then also, can you explain briefly why also it is taking 18+ months to get a new fire truck?
Sure. So yeah, the lead time on new purchase vehicles are continuing to increase to the point where we're starting to have conversations about CIP items that are years and ahead versus 10 months. So we've gone from 10 months to upwards of almost 3 years. So we're looking at that pieces of apparatus and making these recommendations to get it timed where we had put together a plan where we're buying a vehicle every 3 years so that we can maintain purchases every 15. So that's meaning that we have 5 main pieces in our apparatus fleet. So we're getting on a regular schedule of the 3 years. So that essentially was in place, but we have to react to that to keep the vehicles from getting that much older. The 2 vehicles that we do have on order, we've transitioned that to a galvanized frame rail because we've just seen the level of corrosion that's occurring. You know, I'll contribute a lot of that probably to the brine that we're putting on the roads. It's keeping the roads safer for travel in the winter, but it's definitely has an effect on the vehicles and the steel on the underside. So to combat that 2 ways, one, changing from a steel to a galvanizing, which is a process to the metal to make it last longer and less corrosion. And then also I mentioned earlier, we're starting to do an annual application of a coating on the underside of the vehicle, which will do more than just the frames. It'll be the air tanks, the wire harnesses, all of the things that are impacted by that product on the road. And so that's significant things we're doing to try to reduce that. We also have Red Power Diesel, which is a repair facility for Pierce and other manufacturers as well. He's offered to be involved in some of our pre-construction meetings to kind of help us look at some of the different areas where we can just cut down on the corrosion and cut down on the service cost of the vehicles for the ones we're purchasing.
What are the other things, Alderman Sevenick, is that Pierce right now is about 240 employees short. So they just built a great big facility to take care of just ladder trucks. And of all the lines in that building, I think there's like 6 or 7 lines. Only one is operating because they're just short of employees right now. So, and I think that's probably industry-wide in the fire truck building arena, but Pierce for sure. My son-in-law works there, so I know some of the inside stuff, but he said they're about 200 plus short for people.
Oh, thank you, Mayor. One more question, Kevin. I know you mentioned you had like 22 building fires up to this time for this year. I guess my question is, we have these nice trucks and we continue to buy these nice trucks, but we really don't have too many fires to put out. So, but we still need the truck, even though probably 85% of our calls are EMS calls. So, can we get a little baby fire truck that we could drive instead of a big honking one for $700,000-800,000?
Well, we have actually the apparatus that we have spec'd out are a lot smaller than the ones that we've had in the past. For example, Engine 32 is a heavy rescue, and we went down to just a basic small body to match what we have the last 2 new trucks. So we are trying to make them smaller, have less bells and whistles on them, which they're a very basic model that we order. So I know we went through and tried to do a study with having a smaller apparatus, and that just, there's been, I think Grand Chute tried that model, and it just doesn't work because you can't fit the amount of equipment on a small, I guess it would be like they call it a mini pumper or some kind of small rescue vehicle. It doesn't work with having 3 or 4 people ride on it. It's not big enough.
Okay, all right, thank you. Oh, last question I got. Couldn't we Z-Bar rust-proof these fire trucks? You always hear that.
We just went through that,
Oh, I know,
Randy.
but
We just went.
I
through that.
listened to it, but I didn't hear you say Z-Bart. So,
Z-Bart is a brand.
okay, well, don't worry about it.
That annual application is essentially that kind of product.
I just wanted to make a comment. I brought up this comment at our last Nina Menasha Fire Rescue meeting and this is for the public, because the public has no idea the cost of the fire trucks. And so I did my own personal survey, and no one was above $500,000. Everyone thought it was like 300,000 or something. And the new one that we have on order is close to 900. Okay, well, that other truck they're talking about, the ladder truck, that's going to be double. So be prepared for that in the future. So these vehicles are expensive, and like the chief said, the most recent one is a smaller model, and that's still $874,000. So it's a lot of money.
Yeah, thank you, Mayor. I don't know if we're jumping the gun here, asking questions about the budget. You didn't even go through it. I don't know what your game plan was to do this, or are we just supposed to ask questions about it? Or
Yeah, if you're good with that, I was just going to say if anybody had any major highlights that they were looking at to answer questions.
Which is fine, but I guess to credit the fire department and to Alderman Rappello's point, you don't want fires. You don't want them. So you're training the businesses, you're training people, you're doing the job to not have a fire. So that's number one right there. But you got to have the machinery in case you have a fire. So to put it in that concept, just because you don't have fires, you don't need fire trucks. I just don't buy that one. The only question I have, I don't know if I see it on this, is the diesel or the fuel expense budgeting for next year. With the increase in costs and stuff, I don't know what line that is on.
I think it looks like it's a 12% increase, roughly.
How many dollars is that? What account number is it, you know?
0310.
I saw
Yes, it is 0310.
310.
So it's about proposed for next year is about 21,000.
Okay, I see 35,000 or something.
Yes, I see.
Oh, I'm sorry, I'm looking at, that's Nina's portion. I think it's probably was 35, so it's broken up into the 60/40.
Oh, okay, that's split, okay.
The split, yep.
And you feel comfortable with that? It just seems like a little low, but,
Yeah, and like I said, it did, the increase in the fuel, we try and, again, manage that through, through the cities and fuel usage and stuff. So that number is given a percentage through finance, and then that's what we added on. But we're usually really good about being right on,
Okay.
pretty close to on target for that.
Unfortunately, this year has been a long year of paying higher prices as well, so.
right, okay, thank you.
Any other questions? Alderman Nichols?
Thank you. A while back, we approved for Nina Menasha Fire Rescue to enter a study that was being done by an outside group about combining services. And I think I read somewhere that that study was complete.
It is completed, yes. And so where that's at now is trying to find where that balance is on how to be able to do some of those things together. And we've worked on that. We have the Joint Recruit Academy that we do. The training chiefs from that study, so Appleton, Grand Chute, Nina Menasha, and Oshkosh, they have started, so we have the Recruit Academy, but now they're also talking about being able to get together and have all drivers certified so that they take a week-long test or whatever it is. Their plan is that they would do it together. That would save on us having to bring in staff for overtime to help conduct that training. They would use all the training chiefs from the various departments to be able to do that. So things like that. We've talked about some of the other things. We're having a special operations team here in the valley, which we don't right now. We have it through in the state, but not here in the valley. And then there was maintenance, being able to purchase equipment together to save on costs, driving the cost down by joint purchases. So the chiefs are still talking and trying to figure out how to get into some of that. One of the things as far as merging goes, or doing something with another community, the state's going to have to pass some law guideline that allows for fire districting. Until then, it's very difficult. We were able to make it work in Menasha because there's just 2 of us, but once you start entering other communities and 3 communities, 4 communities, then that's a whole different governing body of that fire district. So until that happens, we're not probably going to be able to do any type of consolidation with a neighboring community. But some of the other low-hanging fruit stuff we definitely are looking at, and there's some things that we're hopefully be able to save some money on, but yet still provide a better service.
Great, thank you for the update.
Kevin, should we do a presentation of that? We were going to when it first was released, and it kind of slipped our minds.
Yeah, it did. So
would the council like one in December or January, maybe? No? Okay.
Yeah, just let me know. We can put something.
It's not a huge, long document. It's probably, I bet we could do it in 15, 20 minutes.
Yeah, just to give it a brief overview.
Okay, we'll look at something in January, maybe.
Okay.
Anything else for the chief? Well, thank you for coming tonight.
All right, thank you.
Appreciate you sharing with us.
You're welcome. Thank you for the support, and very much appreciated.
We are good to go. We should probably introduce Liz. I don't know if everyone knows Liz. Liz is our interim? I'm not sure if you're technically an interim, but she is helping us out while Christine is on maternity leave, and she is going to do her best to go through the budget this evening, and if we have questions that she can answer, we'll get those back to you in the next couple days. So Liz, if you'd like to go right ahead.
Yep. All right, is it on? Like you said, my name is Liz. I'm one of the nurses, and we have a PowerPoint here to start. As you can see, there's a lot of programs in the health department. The ones with the stars next to it are supported in full or in part by grants, contracts, donations, inspections, and licensure fees. So that's a lot of our programs are grant funded or, like I said, licensed or and then the ones in red are our COVID grants. So I'm actually gonna, let's see, okay. So then this is our health department mission, vision, and values. Hasn't really changed. Our mission is to promote and protect the health and safety across the lifespan by building those partnerships and providing that high quality service guided by our community needs. And then I am actually going to Chloe's going to go first so she can get out of here a little bit earlier. So she will talk about the senior center portion. So I will let her do that, and then we'll get to the other programs next.
All right, thank you. So I am Chloe Hanson-Dunn. I am the Recreation and Senior Service Manager. I am split between Recreation Department and then Senior Center. So we're finally thrilled to be able to prepare this presentation with having experienced a full year of an open facility. So it's quite an accomplishment, and we are thrilled about that. So we began 2022 expanding our hours of operations from the previously modified hours of 8 to 1, and we still operate on a slightly modified schedule with our hours being Monday, Wednesday, and Thursday from 8 to 4, and Tuesday and Friday 8 to 1. These limited hours are a strategic move, as the last few months of 2021, we were just not seeing the foot traffic during Tuesday and Friday to support the additional open hours, but also due to our staffing limitations. We have continued to see our monthly metrics reflect the interest, support, and excitement of what our center offers, a place to find friendship, health, opportunities, and learning. And at the time of closure in March of 2019, we had 165 registered participants. This time last year, 368 participants were registered, and we currently have 571 registered participants in our database, which we began utilizing in 2021. Leah, our activity coordinator, was covering the center today, and she sent me a text. She's like, I signed up 4 new people today. So she wanted to make sure that we were updating. So it's really 575 people. So we obviously have quite a bit of support, and we are often talking about how we're bursting at the seams and utilizing all of our whopping 4 rooms over at the center, but it's a lot of fun, and that energy is just really great. So we routinely have an average of 165 unduplicated individuals visit us each month, which is a 28% increase from last year. As of last week, we have provided 6,828 services to our community during 2022, and that does not include October. So the full month of October alone will probably add an additional 700 to 800 services that we have offered. Through our internal efforts of providing specific outreach, including targeted marketing, we have seen a 37% increase in Menasha residents using our center. And we will be continuing these efforts, but are grateful to be a space that is sought out and enjoyed by all, as it is necessary to the success of our center to be a welcoming space for everyone to use. This year, we have once again became a meal site for AdvoCap's lunch program. We expanded our after-hour programmings to include square dancing, an instructor-led dance class, line dance class, and then a crafty bunch of rug hookers are looking for additional space, and they see and welcome a number of new faces on their Wednesday nights. And perhaps most excitedly, we have begun offering monthly bus trips, in part thanks to Donna Landers, who's a volunteer, a star volunteer for us. So we had 48 people join us on our first trip, which took place this October, that only left 2 open seats on the bus up to beautiful Door County. And if you guys haven't been to the newly developed Eagles Tower, rebuilt Eagles Tower, highly recommend. It is fantastic. Our growth is far from complete, and we have many goals moving forward. So let's go ahead and bump to the next slide. We will be re-accredited by the Wisconsin Association of Senior Centers, an honor which was consciously dropped during COVID because that allowed us to reevaluate and really build the processes and policies that work for us. It was hard to imagine having just 6 weeks of being open before we closed, and then being asked to reaccreditate and build policies when we weren't really functioning. So we will be reaccredited in 2023. So we focused a lot on numbers here tonight, and I wanted to leave you with what our center means to one of our participants. So I quote, "I don't know what I'd do without the senior center. I'm here every day. There are tons of options for activities, and the center is always adding more. I have made new friends and have found people only to be welcoming to newcomers." I welcome any questions that you might have.
You gonna plug your bus trip for this month, the mystery tour?
It is
Next month, I should say?
Yes, we have a mystery tour happening in January. It is, well, it's a mystery. I literally.
She won't tell me.
I won't tell anyone. I have just found out the details on Monday. So but I think one of our participants is very close to cracking it, because we're putting out clues. So there's clues that are on our bulletin board, and I believe on our Facebook page, or will be released soon. So highly recommend it, and encourage others to sign up.
So Alderman Nichols has a question?
Yes, thank you. I'm pleased to hear that participation from and visits from City of Menasha residents is improving. That's wonderful. I was out and about having conversations a few weeks ago, maybe about a month ago, and I encountered some questions about when will the senior center be open 8 to 4 every day?
Once we're fully staffed.
And what does fully staffed look like?
It is additional 2 clerks. I am moving through the hiring process with 1.
Is it a matter of filling positions, or is it a matter of needing more positions, I guess is my question.
It's a good mix of both, and there's a couple ways I could answer that. Right now, we do need to fill, definitely to be able to have a fully staffed just coverage in terms of hours. And
So there are some vacancies?
there is 1 vacancy at, well, technically 2 because the paperwork hasn't been signed yet.
Okay, but if the 2 vacancies are filled, will that allow being open for more hours or not?
No.
No? Okay. And then the question about the meal site. Those conversations indicated that the meal site had not been up and running at that point yet? Has something changed over the last month, or?
Correct.
Okay.
Yep, we restarted Advocap was ready to come back on October 13th. That was their first day, so it's only been a couple of weeks.
Okay. Thank you. And then every year I ask the same question. Is there a specific reason that the senior center works with Advocap? And the reason I ask the question is because there are always comments, I hear comments about the quality of food that is served.
Advocap is our county's meal provider. So for an easy answer, that is why. I will admit that I'm happy to report that we've heard a lot of more kind comments within this past 2 weeks. I will say, I'll give an example of one group of 4 friends came in and they said, this is gonna be our 1 meal, and if we don't like it, we're not coming back. They've ate lunch there 4 times since that point. So I'm hoping that overall we can see the consistency of the quality of the meals continue to be friendly. I can tell you the curry smelled fantastic a couple days ago. So I'm, again, and it's due to, we don't have the capacity to in-house. That is not at all something that we would want to do.
Yeah, I wasn't advocating for that. I wouldn't advocate for that at all. But I understand that that's the county's provider. Are we required to use the county's provider, or do we have other options since we have our own senior center? And now I'm just curious.
Yeah, I will definitely look into it, for sure. That's, yeah.
Okay. I'm glad to hear that the meal site is up and running again, so that is wonderful. I thought I had one more question. I can't remember it right now, though. Thank you.
Yeah, thank you.
I think it was before you, Chloe, that we did explore the school district, and it
Okay.
was very positive to work with them, except for they were not open several weeks a year. They could not provide the food the weeks that there's a gap in the summer, and then there were some holiday gaps that we would not be able to provide meals. So I don't know if that changed or not, but it'd definitely be worth talking to them again. Otherwise, the opportunity was there and the price was about the same.
Okay, that fills in some gaps, so thank you.
Alderman Grady.
I
Oh, sorry.
Too bad. I'm just
We'll come
kidding.
back to you.
Thank you. Chloe, question. Are we still monitoring or having the people that do come to the senior center register their address in their county? So
Oh,
we're
of
keeping
course.
track by Menasha, Appleton, Neenah, whatever.
Definitely,
Are
yep.
those numbers that can be provided?
I have them right here. So we have, and this was, what, two weeks ago? So again, those 4 people from today are not included in these numbers. We have 229 Menasha residents, 2 Town of Neenah, 56 Fox Crossing, 77 Appleton, 142 Neenah, 26 no residency was identified because of our software. It's kind of weird. We'll dig into it.
No, that's
Maybe
fine.
they didn't provide an accurate address, but other, and then 39 others.
Okay, thank you.
I do know we pull as far as Freedom, Oshkosh, and occasional Sherwood.
All righty, thanks.
56 was Fox Crossing.
Alderman Nichols?
Thank you. I don't have a question, I just have an idea that I'm going to throw
love
out
ideas.
there. Those lettuce grow huts from Fork Farms, I just always thought that would be a fun thing to have at the senior center, to be able to grow their own greens. The school district has one up on the 3rd floor. And in classrooms throughout the district, to grow their own greens or herbs, take them home or sell them as a fundraiser. Just my 2 cents, I think that would be an awesome thing to have at the senior center.
Thank you.
You're welcome.
Any other questions for Chloe? Alderman Sevenick?
I attended 2 events this year, and I did my own survey, and I would say that 80% were not from the city of Menasha that attended. So maybe your more active, involved people are from outside that come to the senior center, but I just want to make it clear that it's not utilized as much by city residents as you might have tried to indicate, because every time I question and ask people, and I'm glad you were honest, because I was surprised by the Freedom ones too, and you probably know who they are personally. So,
I do, yes.
and they were at both of those events, but I'm telling you, and then those who said they were from Menasha, eventually I found out they were from Fox Crossing, but they just said Menasha because that was their address.
And we use myvote.wisconsin.gov to verify residency. So it's a little bit of an administrative detail that we follow up, because our software system, because of how our boundaries are laid out, we can't automatically assign. So we go in, verify, and then tag them. So, and you're right that, well, perhaps during those groups, we see each card players are a usual set. It's event goers are a usual set. So our event goers probably are, from your experience, a bit heavier on outside residents.
And I'm still very pleased that we do receive funding from Winnebago County. And so at least we have that aspect of coming in as far as funding the senior center. That makes me still feel comfortable about it. I mean, you do recall that in 1982, I was on the council when we created the senior center, and now I'm using it. So the mayor's laughing again.
I am. I did have someone ask if we carded people at the senior center. I told her no, she was welcome to go, but I didn't ask her how old she was.
But I also want to say that the 2 events that I went to were very well attended and were fun to attend.
Thank you.
With that, thank you for coming tonight, Chloe.
You're welcome.
We'll see you again next Thursday.
Yes. Thank you.
All right, so this, if you've done this before, the PowerPoint will look exactly the same that it did last year. I took what Christine had and then changed things that were accomplishments of this year and, edited things that we, had changed in budgets or programs. So I will go through most of this, but there's a lot of stuff on some of these slides, so I won't probably go over every bullet point. It will be on, saved on the city website if you wanted to go back through. But if you notice I missed something that you wanted to discuss, you can just stop me. But and I'm not an expert on any of these programs, so if, like I said, if I can't answer your question, I will get it for you. We have a lot of great staff that we work with that are, experts in a lot of their programs. So employee safety we'll start with here. And the Menasha Health Department does maintain the city's safety program for the employees. The Menasha Health Department staff educates the employees on safe work practices, policies, and work environments while maintaining that compliance with DSPS and OSHA regulations. Some things that, this is Todd that does our employee safety mostly, and he does, conduct that respiratory fit testing, the hearing screening, investigates all employee injuries, and then does work with employee, with the CIVMIC grant to get some of that stuff. This is similar budget as last year, funded by the tax levy and the CIVMIC grant. The next one also is a Todd program. It's the sealer of weights and measures. And through this program, the staff complete inspections, respond to complaints, and promote consumer protection. They inspect business devices, ensure that purchased goods and services are at the quantities and rates offered. And some of his major accomplishments this year, some numbers, he had 387 devices inspected, with 7 temporarily removed, 3 complaints year to date for compliance. He continues to complete his mandated education, and then he did take enforcement action on 2 businesses. This is funded mostly by license fees and is similar as last year. Health Department, this is our big budget here. And I do have the page numbers on there on the top. This one's 278. So this budget is our Health Department budget. We do still run at a level 3 Health Department, and that is with this program, we provide those school health services for the Menasha Joint School District and the public health services for the city. Some accomplishments, numbers. We still are the lead department for the COVID public health emergency response. As it is weaning down, we still are doing much work with that. For the school, we have seen a major increase of our vision and hearing this year, or last school year. So this would be the 2021-22 school year. That's how we do numbers for that. And then, because we like to look at the whole school year, that was back to normal numbers at 2370 for our vision and hearing screenings for that. Nurse encounters, that would be like kids coming down to the nurse office, that 882 during that school year. Communicable disease management, obviously, as you can see, we have kind of 2 numbers. 2021, we have 9,166, whereas this year to date, we're at about 550. And that is including those COVID numbers, so that's why that's so high. 5,000, yeah, sorry, what? 5,500, yeah.
278. Yeah, that's where the budget is located, yep. We did, last year, we actually didn't have any home visits. This year, we were back up to 33 home visits, which included, it includes adult home visit, new baby, lead, latent TB, you know, all of that home visit. Flu vaccines for children and flu vaccines is a big component, and what we do last year, this is how they had the numbers for the PowerPoint last year. So they did look at it as last year during the 2021 flu vaccine clinic, we always do a mass clinic, we did 165 and then a total of 450 that whole year. This year, we're at 343 year-to-date for our flu clinics. We did have our mass clinic back in October, and then we did also have like a mass staff clinic. 20 car seat fittings were conducted this year already, and then our schools for compliance for immunization were 98% for our public school, and then 98 and 97 for our privates. And then another big thing that we do is the CPR training for our staff. We had 108 last year, and then year-to-date this year we did 105. 50% of this budget is paid for our school nursing services, so that is paid by the Menasha Joint School District. So the nurses do spend 50% of their time at the schools. And that is the personnel, as you can see, it's one full-time office coordinator, one full-time public health director, and then 2.75 FTE of nurses. A lot of the nurses have other grants that they work on. And then some health educator time, Spanish interpreter, and then our registered dental hygienist. Yep.
Question, Liz, I don't know if this is for you or maybe Jennifer. The personnel, the 5.5, is that an increase from 2022?
No.
It's the same number of people that we had? Because I'm looking at the salaries and the wages, and they seem to have gone up a little bit more than...
Do not think it's an increase for FTE for our regular staff. I didn't look, I mean, I could go back and look, but to give you the exact, but...
Jennifer, do you know that, or off the top?
What might have changed, like who's in the wages?
Well, the wages, but I just think maybe it's a personnel change, but maybe not.
Not a personnel change.
Oh, okay. As long as you can, if someone can get back to me of what the increase is there.
Yeah, so as, kind of as I was listening with fire, so like the personnel and the wages, the fringes, all of that is automatically, it goes into our budget, and then we enter all the rest of the stuff for the health department budget. So I think most of the increase is through that. Environmental health is the next program, and this is Todd's program also. He's an agent of the state for DADCAP, DNR, and DSPS. He provides those DADCAP inspections, which include that retail food, swimming pools, hotels, motels, touring homes, school food service, and then mobile homes, tattoo, and body piercing. He does DNR inspections for asbestos and commercial building demolition, and then a lot of human health hazard complaints, investigations. So this year, he still did provided the COVID-19 environmental health to the businesses. He was key to that, as he has good relationships with them. He did 78 licensed inspections, 7 pre-inspections, 7 complaint inspections, and then 12 re-inspections. 61 human health hazard complaints,
41 dog bites, and 22 DNR inspections with 6 enforcement actions. And that is funded by the license fees in the DNR contract. The one thing that did change on that was the ability to reimburse did increase to $17,500. And it was, I think, like either $12,000 or $13,000. Next program is the Health Screening 60 Plus, which is one of our nurses, Megan, does that, and she works to provide the older adults health screenings, education, and wellness activities. In 2022, they were able to add in a lot more of their programs. The Stepping On started Tai Chi, Healthy Living with Diabetes, Lunch and Learns, Walking Club, Memory Cafe, blood pressure screenings, wellness labs, and then the older adult influenza vaccine clinic. The past years and what we would like to add in the future, as you can see, we didn't get all of that stuff added in yet. Skin cancer, oral health, hearing, vascular screenings, those she's working to get back into the schedule. In 2021, you can see that she saw 147 people, where this year to date, she's at 460 people that received 602 health services. That is funded by, grant funded by the Winnebago County Health Screening Plus. Prevention is also grant funded, and this aims to prevent the chronic disease through the promotion of physical activity and nutrition and community health planning. This program also supports activities related to the National Public Health Accreditation or Performance Management, and that is what the health educator that uses this grant is using more of it for the performance management at this point. She has completed her results-based accountability certification course, and then we did have a public health intern this summer that created a program management system for her to be implemented by all the staff. School health aides. This is funded by the Menasha Joint School District. Our school health aides, under the direction of the public health school nurse, provides the health-related services for those school-age children. Things that they do, they respond to those accidents, illness, medical needs. This school year, what I pulled was they had about 5,315 health office visits to the school health aide. They did, through the 2021-22, helped us navigate the school-based testing program and some contact tracing. We did have, we didn't add 2 new health aides, we just replaced 2 health aides. 2 health aides left at the high school in Butamore, so we did fill those positions for this year. And their wage did increase a little bit, but they are funded by the school district. Our dental program, this is Claire, runs our dental program here at the health department. It's the Menasha Healthy Smiles. She does screening, education, fluoride, varnish, and referral. And then she also does the sealant program, which I'll get to. But through her program, she works to prevent that tooth decay. The program is cost effective, encourages dental homes, prevents tooth decay, and prevents ear visits and hospital treatments. She was able to see in the 21-22 school year, screen 1,407 children, apply 597 fluorides, and then did refer 93 children to treatment. This one is funded through a United Way grant and then medical assistance reimbursement. This is just her chart that she added in there. So that's from the beginning when our program started. It went from, obviously you can see the 18.5 down to 9. They did have that dip at 4 during the COVID pandemic, and that was more due to the size of, we didn't have as many kids. So then the rate did look less. A next grant-funded program is communicable disease. Menasha Health Department assists in communicable disease surveillance, contact tracing, public education and outreach, and then other infection control measures as required under the Wisconsin statutes. Things that the nurse did with this grant this year, obviously conduct communicable disease follow-up, and then does run our social media page and post things based on the communicable disease prevention. LEAD is another fully grant-funded program, and that is a nurse that works on this grant and monitors blood lead level tests, provides resources, and arranges for environmental assessment of lead sources in the home as needed. We review all the reports as they come in. This year, we follow up with kids that are over 5. We did have one that was a 7 this year, so we did do home visit for that, and did 2 other just lead education home visits for lower levels that parents requested us to come. We send out lead packets to families with new babies, just to let them know about like water lines and lead information.
So to go along with that, we are at just under 100 lead laterals left in the city, and we do hope to have them all replaced by the end of the year.
The next program is the immunization, which is also grant funded, and this one works to actually works with families to get them up to date for 24 months of age. So that's what the goal is for this one. So she works with the families by sending out letters and tracking vaccination records, offering up, we do have monthly immunization clinics. Year to date, we are, for the 24-month age, we're at 73% that are up to date, who turned 24 months of age, that had the recommended vaccines. This nurse also is a member of the Northeast Wisconsin Immunization Coalition, which is a coalition that works on immunizations and trying to get those rates up higher.
Thank you, Mayor.
Oh, sorry.
That's okay. I had a specific question about vaccines in this group of children. I'm pleased to see that school-age children are still at 98%. That is remarkable and to be commended. One of the results of COVID is that this age group is behind on their vaccines because of not being able to go to their regularly scheduled appointments and get these routine childhood vaccinations. And the health department was awarded a grant some time ago and the money was to be used to I just lost my train of thought here, to study and the community impacts of COVID and then address specific needs. So my question is, can some of that grant money be used to reach these people and address this need and get them caught up?
I am not positive on that. I would have to look at what the grant, we do have, there'll be last that we talk about is the COVID grant. So there is some grant funds left for COVID, and this could be something that some of them are a little less flexible, could be something that we look at. I know that the nurse that does this grant right now, Megan, she is working with like this new WIC, and they're really trying to find a way to get to these kids. So I know they're working hard to try to do that. The other thing with this number is it says 73%, which is accurate. So that means once they turn 24 months, we have to go off of that number. So that doesn't mean that now they turn 25 months and then they went in. That's not counted in this number. So it is usually, like when we look at like behind up to date, typically is more in the 80, between 80 and 90% for that. I did not run that number, but we can if we needed to. So I know that work is being done to try to address this. And, we continue to do our monthly clinics and offer anyone can come to our clinics. And then I'll definitely write down that we can look to see if that is something that we could use.
I think it was like some sort of community impact grant to study the community impact and use that money to address some specific need or needs.
Yeah, I think that might be one that we're getting to. And they have like a list of what you can use it for, and we could definitely look at seeing if that's something that we could use it for. We're looking for a project still. So
thank you.
Yep. Maternal and child health is also a fully funded grant program. The Menasha Health Department with this one provides technical assistance to childcare and work sites to improve breastfeeding policies and practices that support the maternal and child health. Our health educator has worked to initiate contact with local child care centers. This one was, some of the funds were able to be redirected to support COVID last year, so we did use some of those funds for our COVID response. They attend the Breastfeeding Alliance. And then we did have one nurse just recently become certified as a lactation consultant. So she, it's a pretty intensive program that she had to go through, but now the city does have that to offer. So she's able to be certified and go and do lactation for, all of the city residents as needed. She got one already. She just got certified in September. She took her test and passed and certified and just had her first home visiting this last week. Dental sealants, this program goes along, with the dental program, prevents that tooth decay. For sealants, this last school year, the 21-22, she screened 270 children and then applied 235 fluoride varnishes and then attends her Seal a Smile. This one is funded by her Seal a Smile grant and then the Medicaid reimbursement again. This is the opioid data to action grant, is also a fully funded by grant. And this one is the MCAP program, which is the program that links people suffering from substance use disorders to recovery coaches. This is in collaboration with the Menasha Police Department, the library, the Nina Menasha Fire Rescue Gold Cross, and then Unity Recovery Services. The Unity Recovery Sources are the people that provide the recovery courses, coaches, and peer support specialists. This one, the funding will end at August of next year. So that funding source will end. They were able to continue to offer the services through the pandemic. did not get good data on how many, but I was talking to the nurse Linda, that does do this. She said they're at about approximately 180 referrals, which last year they were at, so in a year, they were at 80, so they're up 100 referrals for that. With that, it says the secured evaluation and marketing support. They did develop some program literature this year, this summer, that was done by a local marketing agency. They created a MCAP rec card is what they called it, and then a Menasha Community Addiction Assistance Program First 100 Referral Report. So they will, bioterrorism, this is also a grant-funded program, and this program maintains public health emergency plans and the capacity to respond to emergencies. Accomplishments secured the additional funds this year, continue to be a member of the Fox Valley HERC, and the staff members that do this run our annual influenza clinic as a public health emergency exercise. 24/7 is a program that provides staff with telephones to maintain 24/7 communication. That's not much changed. Okay, and then we are on the COVID grants. So I kind of left them all towards the end. So this one is the COVID tracing and detection. This one supported COVID disease investigation and testing and data reporting activities. So with this grant, we were able to complete thorough and timely COVID disease and contact investigations. Like I said, it's a grant fund, and this one remains. So it was supposed to be ended after October of this year, and it will get extended through June of next year. So we will continue to fund a couple of our LTEs that do contact tracing with this money. Other things can be technology and supplies. The workforce grant, that was also a COVID grant. This was given to support recruitment, hiring, and training personnel to address projected COVID response needs. And with this, we did, like I said, this is the grant that we were able to hire the intern. She did complete that performance management project. We did hire a LTE public health nurse who will be funded through 2023. And then we did have 2 staff attend the National Preparedness Summit in Atlanta. This fund, it does go through, it looks like, June of 2023. The COVID vaccination grant fund supports our activities and expenses related to providing the COVID-19 vaccine. And so major accomplishments administered the COVID vaccine to indicated populations at clinics at the Menasha Health Department and other areas. We, I don't have the number on here, but I have it on mine, is in so calendar year 2021, we did administer 4,463 COVID vaccines, and then year to date, 2022, we've administered 955. This grant funding goes, it can go through June of 2024, but it will be expended by then. That mostly will have, I think we have a little fund balance that we're going to be using for next year, but there isn't a ton of this left. So we'll continue our clinics with this. We have a nurse that we had hired through this grant to run our COVID clinics.
Can you repeat those numbers again?
Yeah, so calendar year 2021 was 4,463. And the year to date is 955. Okay, and then this is our last one, and this might be the one you were talking about, the Health ARPA grant, the COVID-19 Health ARPA grant. This grant funding provides resources to meet and address emergent public health needs, including measures to counter the spread of COVID-19, provisions of care to those impacted, and programs or services that address disparities in public health that have been exacerbated by the pandemic. So for 2022, we didn't spend any of the funds that we budgeted for it. We do have till December of 2024 to use that funds. We did put all of it into the budget for this year because we're unsure what type of project we're going to do yet. There's, like I said, there's 2 years to spend down, and they would like to identify a meaningful project for this one.
Thank you.
Yes.
You're good.
Okay. More of an operational question with the COVID vaccine. 2 weeks ago, I came in to get an appointment. I've had all my shots here. You're great, because I'm afraid of needles, and I've had no problems with any of my other vaccines. But I can't get in till November 16th. And I said, oh, you must be really busy. No, we don't get a room that we can have people sit in, which is, I find, a poor reflection on the school. We should be giving these shots out periodically more often, but if people don't have a place to sit, I think that's a poor reflection that we can't have a room to do these vaccines more often.
Yeah, and I feel like this was probably our biggest break that we haven't done them. We typically do them like every other week. With the election coming up, we did find that we had limited space. So our last clinic, I think, was probably 2 weeks ago, and now we don't do one for, so this was our biggest, it was our biggest break of not having COVID vaccine, but we do try to do them every other week.
Then just with the COVID tracing,
Yes.
I had COVID in August. That's why I had to wait for the shot just because of that too, but I did my own COVID test and came out positive. So how do these, what are you doing to trace people that are doing all these home tests now? And is this money that we can use in another COVID situation that isn't being used to trace people?
Yep, with home tests, we can't trace with home tests. So unless someone would call in and say, I took a home test and I was positive, then we would do the education with them. But otherwise, at this point, we are unable to trace with the home tests.
Thank you.
Alderman Severnick.
Thank you, Mayor. Liz, seeing you're the acting health officer, I'd like to, I guess I could speak on behalf of all of us here to say that we are absolutely floored by the amazing job that your department did during the COVID-19 process. I mean, I've heard nothing but absolute positive responses, and even my personal experience was very positive. Your department can be very proud of that. I know that Tom talked a little bit about it, but if people want to continue to get their booster, could you explain to the public, because this is being televised, when they can come in and have that done? I was told on Wednesday, so I don't know if that's true or not.
Yep, so we do have on our website, we'll have a schedule. It's typically, it is usually Wednesdays, not every Wednesday. It has in the past been like 2 Wednesdays a month. So I know we're doing like the 16th and the 30th. And then I would have to look at December. Typically it's from, like we'll typically do like 8:30 to 12. I know that they did extend it if we are getting too many people. We do try to extend that to make it a little bit longer. And then, you know, we've found that it has been successful every other week. You know, we're full, but we see it still seems to work for the public at this time. And then if we absolutely, you know, if they need it before we can give it, we try to help them find the best place to go.
Okay. Okay, and then I guess on a personal note, seeing that you are the acting health official, I have to say that from my personal experience for many years, I have had nothing but the highest respect for Todd. And I know I get feedback from businesses that have worked with Todd. I've had feedback from other aldermen about Todd. And he is an outstanding employee, and he's an asset to the city of Menasha. And I'm very glad we still are able to retain him. Mm-hmm. And please put in his head that he can't leave.
Thank you. I will let him know. Yeah. Yep.
Alderman Hammond.
Thank you, Mayor. I just have a question. You said you're yet to determine what you're going to use this grant funding for. Do you know what some of those meaningful projects that you're looking at may be?
Question.
I do not have, I don't. I'm not sure. Christine might have some ideas, but I think I'm not sure if she even knows yet. Like that top portion is what we have to use it for, and then there is a list of like ideas and kind of ways to use it, but I don't know if they really sat down and decided the best way to use that or not. And even looking to see if you know, it's a lot of money, to see if it has to be just us or if we can expand to making it something that can help, you know, other departments too.
Okay, thank you.
Christine and I had some very general discussions, but there's nothing really fleshed out or even that we talked about a specific project yet. It was more that there's a significant amount of funding there and we want to do something that will have a long-term impact. So after she gets back, probably early next year, we'll probably start that discussion, and I would assume that we'll be coming back to the Common Council for discussion at that point as well. So if you have ideas, please let Christine know.
Mm-hmm.
Is that the last one, Liz?
That.
Okay. Any other questions for Liz?
Yeah. That's our
Great
staff.
Picture.
It's our last year's. We couldn't all get together again, but it's still the same staff. So. No, I thank you guys. Obviously, I'm just the acting health officer. I don't know, not the expert on any of this stuff, but you know, if you ever have questions or anything, feel free to drop by, ask us questions, and we appreciate you guys.
I think you're selling yourself short. We had a nice discussion a couple days ago about this presentation, and she said the same thing then, and then she proceeded to tell me all about every one of her budgets and how they all worked. So, did you have something else, Alderman Nichols, too?
I think I'll save them.
Okay. Well, thank you very much, Liz.
All right, thank you.
We're going to take a couple-minute break here, and then we'll move on to the finance section. Okay, we are all back from our break, and we do have the finance department here to go through their section of the budget this evening. And apparently they're not going to move up to the front table.
I did just want to address your question, Alderman Grotti, about the health department wages. So there are no new positions, but outside of the cost of living adjustments and any step increases, there were a couple health nurses that they just changed their allocations, and they do that often just to match their grant accounts. One of the nurses was like 1.5%. I think the health educator was another 1.5%. So they just made a few adjustments to where they're allocating. So that should be the difference, basically. All right, we'll start with the finance department budget, and that starts on. Do we?
Looks like short hair.
Well, it might have been from this summer.
You have short hair.
Oh, yeah. Changes colors and, yeah. I don't have a presentation. Yeah. Yeah. So I'll start with the finance department budget. That's on page 204. Just a couple of things to highlight from 2022. Obviously, we were working on implementing a new property tax software and budgeting software. And we obviously completed all of our audits for the year timely, including the TIF 9 audit, which we'll actually bring forward to you folks for to place on file soon. So that is all finished up. And as far as 2023, one of the things I need to work on is seeking out a new special assessment software. Now that it was part of with the city of Neenah, part of the tax collection software. I didn't find anything in last year that I was super crazy about, so we're going to continue to look for a program that suits our needs for that. We just obviously continue to monitor our debt, bring forward the borrowing approach that's the most beneficial for the city, and always constantly monitoring our TIF districts to make sure that they are in good financial condition and that they'll close in a good position. So we're always working with community development on that. And we'll probably further our discussions on TID 14 as well, as far as what we want to do with that TIF district in 2023. And we will also start accepting credit card payments with our property taxes, and then rolling that out with other city payments as we go on throughout the year. So that'll be one of the enhancements with our property tax program that I think will be a nice feature for residents. As far as the budget itself, the finance budget, again, it's on page 204. There are honestly very, very little changes. Our accounting/financial line is where we pay our annual audit fees, basically. In addition to an annual increase, we do have additional reporting procedures that they have to do as we spend our grant funds. So the increase is a little bit more for that. The in-house infotech line, that's our IT line. I'll touch on that in our IT budget. But other than that, there's really not all that much that's changing in the finance budget, unless anybody had any specific questions. No? Oh, Randy, sorry.
Yes, Jennifer, quick question. With all this work that you've been working on with the budget and things, how is your schooling going?
I am studying.
Oh,
yeah.
Okay, good.
Spare time.
Okay. Are you progressing the number of credits, or how close are you to graduating?
I have to actually take the courses themselves, but the study courses I'm in the process of.
Oh, okay. So you've made progress?
Yes.
Gotcha. That's
Yeah.
all we can ask, little steps. Thank
Yep.
you.
So yeah, any?
Thank you.
Specifically with finance?
Well, I'm just going to allow you the opportunity to answer the question about telephones. In all of the budgets, I'm seeing a significant decrease in telephone line. Do you know what that's about?
In some budgets, it's a combination of our local phone service and cell phones.
Okay.
I know the cell phone contract, we had switched 2 years ago. Most of our plans are significantly less. So in most departments, that's being reflected. I think in a lot of departments, they're just kind of, I switched a lot of kind of budget numbers to match actuals because they are down quite a bit.
It's certainly not a significant
No,
amount of
but there are-
dollars, it's just the percentage that
It is
jumps
across the
out
board in all the
across the
telephone
board.
lines, yeah.
Thank you.
And also a couple just one-line budgets that we have. One of them is the illegal tax refunds, and that is basically an account that we just use to pay any refunds that would be the result of assessor error or correction. It's usually just the city portion, as we can charge back the other taxing entities. So that's just, we just budget a little bit for that. That's also on page 204. And then there's also the uncollectible debt budget, again, just a one-line budget. Obviously, we use that to account for, to write off any uncollectible debt. It's usually personal property debt or accident damage claims. The expense occurs when we would send the account off to collection, and anything that we may receive would offset that. But annually, we do bring those write-offs forward to council for your approval to allow us to write those off once they're past their collection period. And then the assessor budget, that is on page 201. As you guys know, we contract with Associated Appraisal, and our contract goes through August of 2024. So there are no, basically no budget changes in this budget. Our contract amount is the same. Let's see, and again, continuing to work with them to ensure that we keep our level of assessment within 10% of the city's equalized value, which that was the case for 2022. So that's important that we stay as close to market values as possible. So for 2022, our assessment ratios were well within that. Our Winnebago was 0.9630 and Calumet County was 0.9446. So we're doing good there. The budget itself, there's basically no change to that one as well. So,
Jen, do you want to go into that we've made that decision that we're going to be updating on an annual basis? And if the council noticed, a lot of the assessed rates in other communities are dramatically higher than us because they didn't update for market values this year. But if you look at our equalized rates, they are all pretty consistent.
right, so like I said, our contract with Associated Appraisal ensures that they keep us within that 10% of equalized value. And that is, you know, really important to keep us in line, and that taxes are distributed uniformly as they should be. So we don't have those big swings either. For next year, unless you would hear different from me, the plan is that we would not have to do a full revaluation, that they would just be able to spot check neighborhoods and make sure that they're in line. So that is the plan for 2023, unless something would change in the next couple months.
But either way, it's a full, it's an annual reassessment.
Right.
Okay.
Right. And then the IT budget, that is on page 167 in your budget. A couple of things from 2022 to highlight, just picking a few here. We upgraded our firewall appliance, so now we have something that is much more secure and a much more robust firewall. We went ahead with the implementation of Know Before. It's an employee security training, and those will be ongoing efforts.
Two of you haven't completed your Know Before yet. You know who you are on the council?
Yes. No, you did. By year end, we will be rolling out multi-factor authentication as well. We did a major upgrade to our BOSS ticketing system. That's what employees use to submit tickets to the IT department. And they upgraded a number of servers and software that throughout the year reached at the end of its useful life. For 2023, a couple of things to note. We're going to work with Ellers, that's a different one, Heartland, to develop a IT security plan. And that's especially important to have that in place to receive funding, should that be available. We're going to look at a network assessment and some penetration testing of our network as well. One of the big things that we'll be doing is transitioning to Office 365. Our current Office, I think it's 2013, becomes end of life in 2023 as well. And then with the plan to move probably to the cloud in 2025. We are going to continue to monitor our nimble storage as our data is just, obviously it's growing a lot, so just keeping a very close eye on that, and researching if there's any cold storage options that we may want to look into as far as that. We are also looking at refreshing our city website in 2023, so we'll be getting a group together and talking about what it is. We'll take that to committee, and what it is we want to see from that refreshed website. And then we'll continue to work on our GIS, kind of having those conversations, what we want, again, that to look like, what we want to get out of that, and make that project move along. The IT department, or the budget, and I think I've brought this up before, but it's a little bit different. The IT fund is an internal service fund of the city. So for those of you that are new, what that means is all city departments fund that budget through their budgets. So just about every department has a line item called Infotech, Info Services, and that is that department's share of the IT budget. And all of those amounts combined become a revenue into the IT fund. So that's just how that fund works. We did bring the IT budget to committee probably a month or two ago. Not much has changed since then. I probably got a few updated quotes, updated the personnel piece a little bit, but the department or the committee did recommend the budget to you folks. In one of the conversations that we had in the committee, and I had it with the mayor as well, in 2021, for a couple of reasons, we had placed $70,000 in our general fund for basically our IT infrastructure project. It's kind of due to the timing and then the dollar amount of that project. Well, then come 2022, we had about $70,000 of kind of new budget items. So we kept them in the general fund again. So we had a conversation about, now that we have a pretty good 5-year, capital type plan going forward, to not use the general fund for that. I think we've identified that we have probably about $50,000 to $70,000 a year, that we would just move that back into the IT fund. So as far as budgets, it's neutral. It's just how the numbers are going to be reflected. So our plans are not to use that line item in the general fund anymore. It just gets a little bit confusing. So the whole IT budget, it starts on page 168. The revenue line, again, it's just basically one line revenue. That's all of the revenues that come from all of the city departments to fund the IT fund. And then the expenditures start on page 169. A couple items to note: there was an additional health insurance plan that was added. The computer and technology line, one of the things that is part of that line item is the amount that we budget to work with Heartland Business Systems. I did reduce that line item. I don't anticipate not using Heartland. I think it's a great relationship and that we have. But as I kind of anticipated, our IT staff has been able to take on a lot more than in years past, but they certainly are a good resource for, you know, very specific subject matter type things, projects. So I did decrease that a little bit, but was still with the intent that we would maintain that relationship with them. There's a tools and equipment line for $3,140. That is 2 of our copiers that we have on leases. Over the years, we've done both outright purchasing and leasing, and we would put those charges in our printing line, which didn't really make a lot of sense. So I just separated that out for this year to keep the leases separate from our monthly printing costs, basically. And then we have the line that's called specialized equipment. This is the $190,000. This is basically all of our various program, annual maintenance costs, software maintenance, fees, subscriptions, that kind of thing. Some of them are department specific, like the financial software or the assessor software. And then some of them are global costs, our firewall or antivirus, things like that. So all of those types of programs are what makes up that $190,000. Part of that $70,000-ish amount that was in the general fund last year, some of these things now have moved into this account number because they will be regular expenses in the IT budget, the know before employee training, the multi-factor authentication. We're looking at a new antivirus software that's the same as our firewall provider. So those items would be regular items in that budget going forward. So there is an increase in that line item. One of the things that we did see when we were doing our annual CIVMIC renewal this year is that the cybersecurity section of that probably quadrupled. And the questions were much more intense. And fortunately, we were able to indicate a number of items that we had not done in the past that we are now doing, and we have on the agenda for next year. So, you know, some of these things that we are rolling out are at least, well, they're very important, but as far as our insurance provider, very important. So it goes to show that, yes, you know, we do have an increase in this line item, but these are very necessary measures that we need to take to keep our network secure. There are 3 capital items basically for 2023. The specifics of them are identified in the budget on page 370. One of them we kept in the IT fund. That is the $16,000. That would be the annual subscription cost for Microsoft 2022. Like I said, Microsoft 2013 comes end of life. So we will have this annual cost for both the 2023 and 2024 year. And then that cost would potentially become $31,000 in 2025 as we look to move to the cloud. And I do have all that identified in the CIP. The $16,000 is identified in the IT budget on the last line, but all 3 of these requests are in the capital section on page 370. 2 of the items we did move to borrowing, so you'll see the specifics of those requests on page 370. We need to replace our backup infrastructure and our backup hosts, and those 2 items together total $55,500. Our backups have to be watched very closely. The infrastructure is quite old and the backups are failing. So we definitely need to replace that infrastructure in 2023. But both of those items were moved to borrowing with balancing the budget issues. And that is the IT budget.
Alderman Nichols.
Thank you, Mayor. Thank you, Jennifer, for your presentation. The one item that was moved to borrowing, what is the expected lifespan on that? Do we know?
The backup infrastructure? I have to check for sure from IT. I'd say minimum of 7 years because it's the backup. It wasn't extremely ideal to move it to borrowing. But as we've noted already this year, we had to kind of make some tough decisions and move, some items to borrowing that ultimately in the end I'm comfortable with, but still not completely ideal.
All right, thank you.
Anyone else have questions on IT or questions for Jen in general? No one? Well, that's good. The only thing left on the agenda then is, oh, too late.
Jennifer did mention the CIP items. And are we going to go through CIP items with each respective budget?
We should be, yes.
Okay, I just wanted to be sure because I was looking through the agendas and I did not see the CIP on any of the agendas. So just as long as I know what the plan is, I'm good.
And we probably should have went through the fire and police CIP.
Yeah,
we did with police.
I did ask each department to identify their CIP items for 2023, especially those that affected borrowing. But on our last evening, I would plan to just basically have just a short presentation of basically all of the projects per department that we're borrowing for. So you have that picture of what we're borrowing. So
I
put that
appreciate
together.
that.
Yeah.
Thank
I think
you.
that's important for you folks to see, especially the ones that we're planning to borrow for.
And I like to see the whole picture together.
Absolutely.
Thank you.
Yep.
We have no other business. I accept a motion to adjourn.
Motion to adjourn?
Is there a second? All those in favor? Aye. We are adjourned. Thank you.
The University of Wisconsin-Oshkosh Fox Cities campus assists the city of Menasha with video recordings of city meetings. Menasha residents and interested parties can get information about city meetings, meeting agendas, and other documents from the city website, www.cityofmenasha-wi.gov. To express opinions about City of Menasha issues or these broadcasts, contact the mayor's office, 920-967-3608. Contact a city alderman. Contact information appears on the website. Or complete the electronic feedback form on the city website. All public portions of the meetings are recorded in entirety and are not edited.